The first time we see a patient in the office, we begin with a history. And so we want to understand the distribution of pain, what makes it better, what makes it worse. Does it sound consistent with arthritis or maybe something else? And most of the time we'll acquire an x-ray in the office if a patient doesn't come with an x-ray. And then that is correlated with their physical examination, their history, in those x-rays. We put that picture together to then lay out some options for patients. Options could include medications, orally or topically, injections of a few different varieties, and sometimes surgery. If surgery is indicated and desired by the patient, we then go over details of the planning process and expectations around the time of surgery, what we do during surgery, and then what we'll ask of patients after surgery. And then we fill out a booking form in a case where a patient wants to proceed surgically, and then our office staff manages that patient from that day up to the date of surgery. There's a class that happens a couple weeks before surgery where we fine-tune the postoperative plan, where the patient meets the team and has a chance to have questions answered about anesthesia choices, discharge plan, and to have reasonable expectations with regard to what the physical therapists are going to ask of them. And then the day of surgery comes, we still have time to go over last-minute questions. We do the operation with knee replacements. That's usually using a regional anesthetic block in addition to some intra-articular injections to make the patient more comfortable. On hips, usually blocks aren't used, but intra-articular injections of Novocaine are used. That allows patients to begin walking usually within hours of surgery.